On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I will be the moderator for today's webinar. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. However, today's question and answer period will be at the end of the presentation. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it will open up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support question right away. You will receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. To request a copy of the presentation slides from today, please email ltssinfo@kaufmaninc.com. That's ltssinfo@kauffmaninc.com. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled National Indigenous Elder Justice Initiative, Elder Abuse in Indian Country. Our presenter today is Dr. Jacque Gray. Dr. Gray is the Program Director for the National Indigenous Elder Justice Initiative and Associate Director and Associate Professor for the Population Health Center for Rural Health at the University of North Dakota School of Medicine and Health Services. I'd like to thank Dr. Gray for taking the time to join us today. I will now turn it over to her for an introduction to today's topic.
Thank you, Julie. It's good to be here, and thank you all for joining us today. NIEJI, or the National Indigenous Elder Justice Initiative, is a national resource center that addresses Indigenous elder abuse, information, and technical assistance. The initiative was developed to provide awareness about elder abuse as it occurs in Indian country, to provide culturally relevant materials about elder abuse, and to provide technical assistance to Indigenous groups on how to establish elder abuse codes, policies, and services in their communities. We're also charged with increasing the data available on Indigenous elder abuse. First of all, some of the NIEJI resources are our webpage that is at www.nieji.org, and I will be going over what's available on some of those pages in a few moments. We also provide technical assistance for developing a public service announcement, and we'll have examples of that. We have other resources, including publications, presentations, and examples of things that have been developed by other tribes and programs. We have tribal elder abuse codes that have been developed by different tribes, as well as a national state and tribal hotline map where you can get information about that, how to report elder abuse, and the phone numbers for reporting it, and it's done with each state, and I'll talk more about that in a few minutes. We've also developed a Native Elder Protection Team toolkit on how to develop your elder protection team in your community, and some training modules that address elder abuse, financial exploitation, or people in social services, caregiving, and in policy development that talks about developing your elder abuse code and your elder protection team. We also anticipate having our healthcare providers training module and legal The healthcare should be coming up by the end of May and legal by the end of July this year. So when we start talking about elder abuse, first of all, what is it? And according to the National Center on Elder Abuse, it generally refers to any of the following types of mistreatment that are committed by someone that the elderly person has a special relationship with, such as a spouse, a sibling, a caregiver, child, friend, or other family member. Elder justice is another term that you hear, and it's defined as those efforts to prevent, detect, treat, intervene in, and prosecute elder abuse, neglect, and exploitation, and to protect elders with diminished capacity while maximizing their abilities to act independently and maintain their autonomy. So, because of increasing concerns about elder abuse in our country, Congress passed the Elder Justice Act in 2010, and it was part of the Affordable Care Act that was signed into law by President Obama. The Elder Justice Act, again, is part of what's called Obamacare, or the Affordable Care Act, and it sets forth provisions to address elder abuse, neglect, and exploitation to protect elders living in community and institutional settings. Just some of the numbers. In 2009, American Indians and Alaska Natives that were 65 and older made up about 231,000 of the U.S. population. And it's estimated that at the current rate, by 2060, there will be about 630,000. This is tripling the number of Native people age 65 and older. Incidents of elder abuse and neglect are expected to also increase with that growth in the elder population. What that means, 90% of elder abuse is committed by a family member. And elders who have been abused are twice as likely of dying than those who have not been mistreated. Nationally, financial abuse costs older Americans almost $3 billion a year. And these numbers are thought to be an underreporting because of love for or fear of the abuser. So expect those numbers are actually much higher. Now, going back to the types of abuse, according to the National Center on Elder Abuse, there are 7 types of elder abuse: physical abuse, emotional or psychological abuse, sexual abuse, financial or material exploitation, neglect, self-neglect, and abandonment. And because of issues raised by some of our elderly, we took time to do some exploration about spiritual abuse. And according to Duran and Duran, colonization or abuse impacting the values and identity of a person is soul wounding. And we have an article that is scheduled for publication in the very soon that outlines what spiritual abuse is. And I would be happy to make that available once it's been published. Now, let's talk a little more about each of the types. Physical abuse is the use of physical force that might result in bodily injury, physical pain, or impairment, according to the National Center on Elder Abuse. These types of things can include acts of violence such as striking, hitting, pushing, shaking, slapping, kicking, pinching, burning, and additional inappropriate use of medication, either over-medicating or under-medicating someone, physical restraints, tying someone to a bed, locking them into a room, things like that could be considered physical abuse. Force feeding, physical punishment of any kind are also considered to be physical abuse. Now, it may not be obvious or easily visible, but it still can be present. Some examples that we've been given include an elder being hit by an adult child, an elderly man with dementia hitting his wife, a daughter hitting an elder stemming from stress from addressing their needs and their health care issues, and drug taking and alcohol use that leads to yelling and hitting of other family members. Now, emotional and psychological abuse is defined as the infliction of anguish, pain, or distress through verbal or nonverbal acts. This includes verbal assaults, insults, threats, humiliation, harassment, or disrespect. Some of those examples include what we call elder speak, or when you talk to an elder as if they're an infant, giving an elder the silent treatment, forcing them into isolation, not taking them anywhere, giving them locked in a room, things like that, and threats. So some examples of emotional and psychological abuse that we have heard about include grown children moving in with the elder and then drinking, fights, taking their money, chasing away caregivers can be emotional and psychological abuse. Also, confining the elder to one room where they have no interaction with family or anyone living in the household. Verbal abuse by young family members. And children threatening the parent or grandparent that they'll send them to a nursing home if they don't allow them to live in the parent's home. Not listening to the elders when they speak and treating them as if they don't matter anymore. As far as sexual abuse, it's defined as non-consensual sexual contact of any kind. Sexual contact with any person who has not consented or is incapable of consent is considered sexual abuse. Some of those types include rape, unwanted touching, molestation, sodomy, coerced nudity, taking or distributing sexually explicit photographs or videos. Some of the examples that we've been given within Indigenous communities include grandma being raped by a male who was high on meth and broke into her house. She was very ashamed and wouldn't report or tell anyone. And finally, once she revealed it, agreed to go to a hospital for an exam after a number of hours of convincing her. Another grandma was raped by a nephew. She wouldn't talk, and she felt ashamed. An elderly woman that was raped and killed. And leaving an elderly person exposed to make it easier to provide care. Financial or material exploitation includes financial abuse, as it's defined as illegal or improper use of an elderly person's funds, property, or assets. Some examples include cashing checks without permission or authorization by the person they're made out to, forging a signature, misusing or stealing money or possessions, coercing or deceiving an older person into signing documents such as contracts or wills, improper use of conservatorship, guardianship, or power of attorney. Usually that involves mismanagement of the funds that those people are given authority to make use of. Some of the examples are a granddaughter that wiped out grandma's bank account, or misusing an elderly person's monthly check and then not paying for their food or bills, so they have their utilities cut off and they don't have food available. The family gambled away grandma's only income, or the family takes grandpa's personal items. Someone in the family took auntie's check. Children pressured the grandparent to give them money, or the family borrowing money and not paying it back. A granddaughter and her boyfriend moving in and being supported by the elderly grandmother. Or a son named for his father used the name to get access to the father's resources and open credit accounts, which is identity theft. Now, neglect is defined as the refusal or the failure to provide that part of a person's obligations or duties to the elderly or disabled adult. And that can include failure of the person that has fiduciary responsibilities to pay the bills and provide the care for that vulnerable adult, or the failure of in-home service providers to provide that necessary care. Some things include providing necessities, just food, water, clothing, shelter, personal hygiene, medication, comfort, personal safety, and other essentials that are included in an implied or agreed upon responsibility to that vulnerable adult. Some examples of neglect include the elderly uncle confined to the home and the family wouldn't provide any support. Failing to obtain proper medical treatment for grandma, not taking her to her appointments. Or the family locks grandpa in a room at home and his needs aren't met. Not visiting or taking the grandparents to gatherings for that social interaction with friends that they may not get to see. Or leaving the grandparents at home with no way to get groceries, medications, or to their appointments. And as I mentioned, we're just now defining spiritual abuse. And as we define it in our paper, it is harmful interference with the spiritual growth, including corruption of another person's value system. Some examples are preventing grandma from attending spiritual activities or ceremonies, theft of grandpa's ceremonial items to sell or use without permission, comments or activities that are damaging to the elderly person's spirit, or sexual abuse by a spiritual leader. And then abandonment. And this is defined as the desertion of that elderly person by the individual who's assumed responsibility for providing their care, or by a person that has physical custody of that elderly person. Some of the signs and symptoms of abandonment include the desertion of an elder in a hospital, a nursing facility, or similar institution, the desertion of an elder at a shopping center or other public location, an elderly person's own report of being abandoned. So some examples that we've had reported include the family going away and leaving grandma without food or drinking water. Grandpa is left without any resources for personal hygiene, and leaving an elderly person alone while the family goes on vacation or powwow with no one to help or check on their needs. Now, self-neglect is something that's often not understood. It's characterized as the behavior of an elderly person that threatens his or her personal health or safety. It can be things like an elderly person as a refusal or failure to provide him or herself with adequate nutrition, clothing, shelter, personal hygiene, medication, and safety precautions. So it includes situations where the mentally competent elderly person who understands the consequences of their actions and decisions makes a conscious and voluntary choice to engage in acts that threaten their health or safety. This could include lacking food or basic utilities, refusing medications, or hoarding. So now I'd like to talk a little bit about elder protection teams and how they work. The elder protection team addresses the issues of elder abuse and is dependent on the resources of each specific tribe. Possible responsibilities of the elder protection team include educating the community, conducting prevention activities, building collaboration and trust among professionals, elderly, and the family, providing empathetic listening, and implementing an effective method for responding to elder abuse while maintaining confidentiality. It can also include reporting suspected abuse and intervening when necessary, and restoring respect of the elderly. So the members of the elder protection team begins with the elder themselves. And due to the complexity of elder abuse, the makeup of the team may involve different people at different times. It could involve caregivers, healthcare professionals, family, legal representatives, senior services and social services, including housing and other social services, and community members if they're needed. The physical changes and old age reduce the ability to conduct certain activities of daily living and maintain the independence of the elderly person. Some of those things include, as far as physical health, poor vision, poor hearing, declining motor skills, and depression. Some of the mental faculties and cognitive decision-making faculties include difficulty processing information, problem-solving, reasoning, flexibility in thinking, and decreased memory. Some of the social factors that impact the elderly include poor health, retirement, loss of a spouse, or loss of friends, and lack of technology skills. So when we look at types of prevention, there are many ways to help prevent elder abuse and neglect. There are 3 levels of prevention: primary, secondary, and tertiary prevention. Now, primary prevention involves education of everyone about what elder abuse is and how to prevent it, a lot like what I'm doing today. Secondary prevention involves the work done with elders who are at risk. This may include a range of preventive measures such as fall prevention, safety scans of elder homes, and setting up ways of preventing exploitation. Tertiary prevention is how to prevent elder abuse from reoccurring where someone has experienced it before. So then I'd like to move on and kind of shift the presentation from what elder abuse is to what kinds of resources NIEJI can provide from their webpage. Excuse me. This is the homepage of our NIEJI website. It includes tabs up at the top, just below the title, that include resources, elder abuse codes, state and tribal hotlines, training, innovation. All of those are clickable tabs that can take you to other pages with specific information. On the home page, we have a lot of information about what is going on right now. You know, what are the warning signs of elder abuse? We've just completed and been promoting our Elder Protection Team Toolkit. And so there's a place to click on that to get more information. Our online interactive educational training modules are also being highlighted. So you see that. On the right side, when different groups or we are doing presentations or training somewhere, we put the upcoming events on the ribbon to the right. And so you can find out what types of activities are going on and when and where. And if you have activities, please share them with us so that we can get them up there and promote your activity. We're also doing an elder maltreatment survey that tribes can collect the data and we will analyze and get a report back to them. And that's highlighted right there on that ribbon. And then there's a certificate program from the National Adult Protective Services Association for those in adult protective services, and information about that is available. Any funding opportunities and those types of things are available, and this is all on the homepage. When we go to the one on elder abuse and what is elder abuse, you get a page that provides you lots of information. Also on the left-hand side, the menu, you can click on any of those areas and take it to different things to give more information about resources about elder abuse. And then on the right, we develop PDFs or Adobe printouts of all of these materials that you can just click on that and it is formatted and everything for your printer. Okay. The Tribal Elder Protection Team Toolkit, again, you've got the ribbon on the left that takes you through each section, and you can go directly to those. There are hot links in each section that can take you to pages that you can print out if you would like to have those, and then additional sources that are on the right side of the page. Okay, the News and Events tab tells you what are some of those upcoming events. So, you know, it was highlighted on the home page, but here we give a list of all the upcoming events in addition to all the past events that we've had. And then, as you see on the right, it talks about grant opportunities, and we try to put up any grant opportunities for tribes that deal with elder abuse or something we think that relates to that people would be interested in. The publications, excuse me. The publications include some of the presentations and fact sheets, journal articles, things like that we have developed and put up. I think there's also some posters that are up there as well that we've presented at different programs. And then other publications include those things from other groups that we feel like are important documents that would be helpful for tribes in working in elder abuse. Our presentations, we provide the PowerPoints for all the different types of presentations that we have done through NIEJI, and all of those are on the Presentations tab. So presentations like I've done today would be up there as well, including other specific ones like financial abuse and elder protection team, the elder justice survey, things like that. Some of the product examples include, like I said, some of those things that have been provided by other programs that they developed. We've got a banner. There was a billboard that was developed in one tribal community. Placemats that they used for their senior center that children had made about their perspective of their elders and elder abuse. There's another one that has different questions, and you fill in the blank with the answer. There's a word scrabble around elder abuse that's a placemat, and also a word search so that your elderly have things that they can do and doodle with while they're sitting at the table. We also have flyers, the Lakota Advanced Care Planning brochure, Ways to Love Our Elders poster, things like that we have developed that are available either through NIEJI or through other resources. These are some of the, as I said, fill in the blank on the different, you fill in the blank to name what the term is. This one at the bottom is a word search. There's a picture of our Ways to Love Your Elders poster that is 11 by 17 inches, and we can send those out if you need them for your program. And then there's a tab for websites and tools, and we have a lot of resources here and links that will take you to websites that can give you a lot more information. Some of the ones that I'll highlight are the Bureau of Indian Affairs, the Adult Protective Services Handbook, which is the model that they provided for addressing elder abuse within the tribe. On the National Center on Elder Abuse out of Southern California University, and they have some really good materials there as well. But there are lots of other materials, curricula, and things like that that could be very useful on this webpage. Now, this is our map for state and tribal hotlines. And this is a clickable map, so you can click on your state, whatever that might be, and it will bring up the list of hotlines for reporting elder abuse in that state. You can also, down below the map, is a list of all the states that you can just click on the state, and you'll get the same thing. Here's an example of Alaska and some of the lists. It lists them by community or by village. Some of the others list them by county and by tribe within the state. So there are over 7,000 hotline numbers that are included in this database that supports this site. Some additional resources that are available, like I said, the training modules. You can click on the training tab, and that will take you to the training modules about legal, policy, financial exploitation, healthcare, social services, and caregivers. This is the opening of that training module. We launched it first almost 2 years ago, And it's designed for the professional disciplines at this point, and working on caregiving for Native elders, recognizing elder abuse, how you report it, things like that. So the modules have valuable information so that you get a cultural understanding and best practices for use by the various disciplines to address elder abuse and neglect in Indian country. And each of those training modules includes aims and learning objectives for professionals working closely with Native American elders. They provide ways to identify the signs and the risk factors for elder abuse and neglect, and how to report that suspected abuse to the proper authorities. They also include culturally appropriate practices, such as use of language while working with Native elders. And all of that helps the professional to address these concerns in a respectful way. And it adheres to Native traditional beliefs and practices. There's also a printable certificate at the end of each training that you can print out. We recommend people go through the elder abuse training piece before going into the individual training modules, just because it gives a good introduction before looking at the discipline-specific training. This is the certificate that you can get. You can put your name in and the date that it was completed, and print that out to have for your record. The NIEJI Innovation Grant was some supplemental funding that we received to address innovative ways of doing elder abuse prevention with American Indian, Alaska Native, and Native Hawaiian programs. It provides opportunities to tribes to develop elder abuse protection programs, to gather tribal data about elder abuse, and for us to produce some additional training modules as far as working on elder abuse in Indian country. So we have had 2 cycles with this of elder prevention 1-year grants for tribes. We awarded 8 grants of $15,000 to $20,000 each to a total of 16 programs, and they're working on their projects now. And we also have an elder maltreatment survey that is available for tribes to collect data with their elderly and send that back in, and we can then analyze it and provide them with data about elder abuse in their community. These are some of the references that we've used to put all of this together. And this is a list of the partners and links to those in putting together our resources. This is our team. I'm the director and principal investigator. Sloan Henry is our project coordinator and has been instrumental in developing a lot of materials and working with the modules. Melissa Wheeler is our research specialist, and she works directly with the tribes on administering the survey and getting the approvals and doing the analysis and getting the information back to people for that. So if you have any questions, you feel free to contact us, any of us, and we would be happy to try to answer your questions. So here's our contact information, and I encourage you to contact us and let us help you move forward in your elder abuse prevention and elder abuse intervention activity. So now I think we can go to some questions if we have any.
Great, thank you. This is our time for questions. Please enter your questions in the Q&A pod located at the bottom right side of your screen.
The first question, are these resources available for tribal use only, or can anyone access them? Anyone can access things on our website and make use of them. We want them available for urban areas and non-reservation areas as well, and we would be happy to work with you. The next question, I'm administrator of a home health agency in the middle of Navajo, Ute Mountain, and Southern Ute Country, and have many natives as patients. How can I get some of the placemats to take to the casino and down the road? The placemats that we have up there are examples that were made in other communities. I know some, like for one World Elder Abuse Awareness Day activity, we had a tribal school had a family emphasis week, and we asked them to focus on preventing elder abuse during that week, and we took 11 by 17 pieces of paper out, and each student did a drawing of what their grandparents meant to them. And then we brought them back and made copies of them to use for placemats. So there are lots of ways that you can get those. I don't remember specifically the samples that are up there, how specific they are to the tribe where they were made. But if you're able to use them, just download them and print them off. I think you'd have to make some adjustments probably as you're printing them off as to the size of the paper that you're using, whether it's standard paper or if it's larger paper. How will I get the certificate? Okay, the certificate for the training modules. As you complete the module, there'll be a page that pops up on the training that you just fill in your name and the date, and then it allows you to print it out so you get it right there. Have you worked with CHR programs? Yes, we have. And part of the caregiver curriculum and things like that are really oriented not just to caregivers, but also to CHRs in the work that they do with the elderly and recognizing elder abuse when they go into the homes and are working with them. If a resident refuses to bathe, eat, or refuse medications, do we report those to the state? That can be reported as self-abuse, but it gets, and that's where a professional really needs to make the assessment as to whether it's self-abuse or can they, with their autonomy, refuse those things. Just because something seems like abuse doesn't mean that the elder has to accept help if they don't want it. So because we're dealing with adults, you can't make them accept the help. But that's where the professional assessment comes in determining whether that's abuse or not. Clients have adult son or daughter lives with them, but they are a burden. The parent allows them to stay. What options are there to help the elder parent? It depends on whether the tribe has an elder abuse code. Only, and in 2011, when we started NIEJI, only about 50 or less than 50 tribes had an elder abuse code. I know more have developed them. We don't have numbers on all of those yet, but we're trying to get some new information on that. But a lot of tribes don't have an elder abuse code, and so that makes enforcing anything about that more difficult. If there is a code, and in some of the violence, the VAWA and tribal Violence Against Women Act and the Tribal Law and Order Act, there are some things that would allow for protective orders to where the children could be ordered out of the home. It really helps if you have an elder protection team that can work with the elder in that situation in order to help. The other thing would be that contacting the police about having them removed. And there are always, complications with families in doing all of that. So it needs to really be done in conjunction with the elderly person. Okay, I'm trying to get to where I missed block. Okay, now I see where I was. I'm doing a presentation in June. How do I get banners? The banner that we had was one that was developed in one of the communities. We could help to develop one, but I don't know that we could get it printed out to you. We could get it sent to you, and if you had someplace locally that you could get it printed, you could do it that way. But email me, and we'll see what we can do to help you with that. Okay, the certificate is exclusive for a program that works only with Indian country. No, the certificate is available to anyone that goes through the training. It provides a lot of information, and so anybody that wants information about working with Indigenous people, it's there for them to complete the training and for the certificate as well. Is there a policy regarding what happens to elders who are present during drug busts, either in their own home or homes of their caregivers? That's something that we've heard that there's some real issues because, say, a family member moves in and there's a drug bust with that family member. The elder, if they're in tribal housing, can actually lose their ability to stay in tribal housing. So, not that there's specific policies, but it would be good to talk with your housing director to see what their policies are, because it's different for each tribe as to what would happen there. But when they receive federal money, there are some limitations on what they can do. How would you help an elder to understand that they are neglecting themselves by caring more about their adult children's needs than their own? That's a difficult one. But, helping them to understand that they have to take care of themselves before they can take care of someone else. Because if they don't take care of themselves, then there's no ability to take care of someone else. And this can be a good approach to addressing some of that. It's not being selfish, or because selfish tends, we think of selfish as self-centered. And that's not what selfish is. Selfish is taking care of yourself so you're able to do those other things for others. You're not being self-centered when you do that. And kind of come at it from that perspective, I think, may be helpful as well. Okay. We are having a difficult time in Wisconsin getting stakeholders to the table to have a tribal elder abuse summit. Any suggestions? Well, I'm not sure if we're talking about one tribe or all of the tribes, but I would start with the Title VI directors and Elder Services directors and asking about, what types of things they would like to know about elder abuse, or maybe even calling it something other than elder abuse. maybe making it a positive statement as to a tribal wellness summit and discussing how to keep elders healthier rather than being abused, and how to respect and honor the elders could be helpful. I'm not sure what the barriers are, but if you have questions, contact us, and we'd be happy to brainstorm that and try to help you with some ideas, or put you in contact with some local people that are real proponents of addressing elder abuse that could help you in pulling that together. Are we able to utilize this information to create trainings for our staff? Yes, absolutely. All of our PowerPoints are up on the website for a reason. You're free to download them. I think they may be in PDF format. So if you're needing them on an actual PowerPoint, contact us and we would be happy to send them to you so that you can adjust them for your own community. Do you notice that there's more elder abuse amongst the different tribes compared to the general population? Also, when dealing with tribes, do you approach elder abuse differently? Well, first of all, we don't know how much elder abuse is occurring because we don't have the data. That's why we developed the Elder Maltreatment Survey, so the tribes could begin collecting some of that data, and we would be able to look at that to know more what is happening in our communities, so more planning and implementing of services could be done so that you have, if you can say that some of the elder abuse is going on, then you have more reason for your tribe to develop codes to address it. So we don't really have that information, but we're trying to help gather it by analyzing the data and getting it back to each tribe. It's similar to the Elder Needs Survey that's done by the National Resource Center on Native American Aging. And so we just need the tribal resolution, and we send you the surveys. You get them completed with the elders and send them back in. We analyze it and send you the report, and you continue to own the data. And as far as the tribes and dealing with them differently, I think all of the tribes are in a different place. Like I said, some don't have elder abuse codes. Some there's not even real awareness of what elder abuse is. In others, they have all adult protective services, and they have policies and procedures for elder protection teams and things like that. So each tribe is at a different place, and part of the innovation grants were to help tribes move on to the next, help them start developing things and then move to the next step at whatever point they were. Okay, are there examples of elder courts to address offenses in a traditional manner other than through tribal courts? Some of the things that I've heard about include an elder council, where when abuse occurs, the person and the elder come before the council, and the elders instruct the person that was being disrespectful to the elder, abusive of the elder, in what their responsibilities are, and traditionally what the expectations are, and let them know that the elders are going to be watching and what they need to be doing to make up for what they've done, and dealing with things in more of a traditional way that way. There are some other forms called restorative justice. Some of those are, like the elder protection team can fit under restorative justice. There's also family restoration programs where they work with the family to resolve what some of the issues are that lead to the abuse, and have kind of like a treatment plan or a case management plan of things that they have to complete to get the family back on track. And if they don't follow that, then there's the possibility of it being taken to court. So it's kind of a, what do I want to call it, a deferred prosecution plan, to where they don't take it to court unless they can't get people to work together to try to make the situation better. Who updates the tribal hotline information? We update that with numbers as we get it. Sometimes we have people contact us and say, hey, our number has changed. Would you update that? And we go in and update it. We also have someone periodically that's, in fact, it's almost an ongoing basis whenever someone has time, going through the list and checking to make sure the numbers are all still current, and there's actually a person at the other end and they're going to the right place and all of those types of things. So we here at NIEJI do all the updates. Can the training certificates be used as the annual continuing education in long-term care? I can't answer that. Maybe Julie can. I don't know what the requirements are, but we wanted to be able to provide something, so if someone needs documentation that they've been through some training, they would be able to get that. Are there any funding opportunities available now to address elder abuse? I don't know of any at this time. I know that ACL has received some additional money, and there may be something coming out soon about opioid problems with the elderly, whether it's elder use or if it's caregiver or someone other's use of opioids. I'm not sure just how it's going to be addressed. There are lots of different ways, and so there may be some money around that coming out soon. And I see that was the last question. So thank you all very much. And I'll turn it back to you, Julie.
All right. Thank you, everyone, for all of your questions. And I'd like to thank Dr. Gray for joining us today and sharing information about elder abuse prevention resources. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.